Okay, let's talk about the leg bones. So these are going to be the two bones of the lower leg. We've got tibia, which is going to be the larger of the two, and the fibula, which is much smaller. So let's talk about tibia first. If we look at the proximal end of the tibia, you're going to see this nice flattened area on the top, and this is the superior articular surfaces of the tibia. So we know articular means joint, right? So it's going to form a joint between the tibia and the condyles, distal condyles of the femur, okay, to form the hinge joint of the knee. And if we come down just a little bit, those superior articular facets are part of the medial and lateral condyles of the tibia. So we would have medial condyle on the medial aspect, and then lateral condyle on the lateral aspect. On the anterior surface of the tibia, we see the tibial tuberosity, and this is a bony raised area, provides an attachment site for the patellar ligament, which is a continuation of the quadriceps tendon into here. So you can palpate this on your own knee. If you go just distal to your kneecap, you should feel this raised bony area. And we know to always put that on the anterior aspect of the tibia. Okay. If we continue along the shaft of the tibia, we see this bony ridge that's anterior. This is the anterior crest of the tibia. And then if we look at the distal end, we see this bony landmark here that's along the distal medial aspect. This is the medial malleolus. So this bony prominence forms the medial ankle bone. So knowing that tibial tuberosity is always anterior and medial malleolus is always going to be on the inside of the ankle, we can determine whether we have a left or right tibia. And so this tibia would be a left tibia. Okay, and it's going to fit really nicely with the fibula. So fibula is going to be the lateral bone of the leg, and this bony prominence at the distal end is the lateral malleolus. And then we have the head, which is going to be the proximal part of the fibula. But they're going to articulate really nicely, just about like that. And so down at the ankle, we've got medial malleolus and lateral malleolus, which are going to create this space here for the domed talus to fit into to create the ankle joint.